Hello, my name is Linda McClendon. I am the Executive Director for the Pennsylvania Health Information Management Association. I'm here today with two health information management professionals with extensive experience in the HIM field and active within PHIMA.
I'm Lisa Hershey. I'm currently an HIM educator.
I'm Laura Rizzo. I'm the Senior Director of Health Information Management at WellSpan Health in South Central Pennsylvania, and I'm also the second-year director on the PHIMA board.
PHIMA has over 3,800 members, and we are a component state association of the American Health Information Management Association, the national professional organization for HIM. Members of the Pennsylvania Health Information Management Association are committed to the maintenance and improvement of quality health information for the benefit of patients, providers, and other users of clinical data. Laura, what are some of the highlights of your PHIMA experience?
I've been a member of the Pennsylvania Health Information Management Association for the duration of my career. I would say the biggest highlight of being a PHIMA member is the networking and the relationships that I've built over time in the association. I found that those relationships have been very helpful in my professional life by being able to talk to others who also have a passion for health information management and understand what I'm doing in my everyday work, and they're able to share their experiences as well. I find that one thing that's been helpful in getting to know other people that are also health information management professionals is being able to share ideas about things that they might be experiencing in their work life as well. I also think that being a member of PHIMA and having the opportunity to volunteer for the association has been very beneficial in my career as well. One thing that I've enjoyed extensively is being part of the PHIMA board and being part of the decision making for a non-profit organization.
Great, thank you. Lisa?
So some of the benefits of PHIMA membership for me have been that I've always viewed PHIMA as a home base for me in my career. I've transitioned through different roles in acute care, behavioral health care, and most recently in education. And as I've transitioned in those roles, PHIMA has served as a resource, a networking opportunity, and a resource with continuing education opportunities to see me through those transitions.
Great, thank you. Tell me about your experience with networking in PHIMA from an employer perspective, Laura.
One thing that PHIMA has, which I found very beneficial throughout my career, is the job bank. So that positions that we might have open in our organization are publicized on the PHIMA website, and it's one way to recruit good people for positions that we might have open. Another thing I mentioned earlier with the networking and talking to others and getting to know people over time is relying on others that may have an experience in or know people that have applied for positions. That's also very helpful because we can talk to one another, although some may say that's a double-edged sword, feeling that because it's a tight-knit community, you don't want to burn any bridges. You want to keep those relationships positive because we do talk amongst ourselves, and we all kind of get to know each other and help each other when we're trying to find people for open positions.
Great. What about from an educator's perspective, Lisa?
From an educator's perspective, the job board and the job postings available on the PHIMA website are very valuable for the students as well as graduates. The other tool that's very useful is the career map. And the career map is an online tool that's used extensively in education to help students find what their career path will be in HIM. There are so many diverse opportunities that the career map gives them an opportunity to research individual careers and to look at which path they want to take as they enter the field.
Great, thank you. What leadership opportunities are available to HIM professionals and students through PHIMA?
Leadership opportunities, I mentioned earlier about the participation on the PHIMA board, and that might include positions such as being a secretary or a treasurer or a committee chairperson, and having that opportunity to do something a little bit different than the day-to-day HIM profession in our regular jobs. So for example, I served as treasurer for a number of years and learned what it takes to operate a not-for-profit organization, how the money is spent, and I found that it was kind of beneficial to have had some work experience in budgeting, but then at the same time doing the budget as a treasurer helped me in my work, so it kind of went both ways. I think being a leader on the board too, as I mentioned, being part of something that you're you're sharing your skills and knowledge for the betterment of the not-for-profit organization. That's very helpful.
Great. What about you, Lisa?
From the student perspective, students have an opportunity to become leaders within the association. And we have a student liaison role opportunity for them. And through that, the students get to work side by side with seasoned HIM professionals and enhance networking opportunities as well. Students also have the opportunity to participate in PHIMA events and continuing education sessions at a significantly reduced rate.
Great, thank you. How have you seen PHIMA work for you as an advocate for the HIM profession?
PHIMA has been involved in advocacy through our national association, the American Health Information Management Association, who sponsors a National Hill Day in Washington, D.C. And then within the state, we've also done Hill Days in Harrisburg to advocate for the profession. And some of the things that we've advocated for are the electronic health record, health information exchange, privacy and security, and other topics that are important to the health information professional and to healthcare at large.
Great.
Most recently, PHIMA was part of the grassroots advocacy campaign for ICD-10 implementation. As an educator, we were able to involve our students through letter writing campaigns to their congressman, and at our campus we were actually able to host a congressman visit, which gave the students opportunity to meet with him and to articulate the need and the benefits of ICD-10 implementation.
Great.
And that was all facilitated through the national and then through our state, through PHIMA's organization.
Great, thank you. Tell me about the educational programs available for those seeking HIM in Pennsylvania.
There are currently 10 schools in Pennsylvania offering programs, accredited programs in health information management, ranging from the associate's level to the master's level. And students can go on the PHIMA website and glean contact information for those schools. And they also have the opportunity, if they are enrolled in an accredited HIM program, to apply for a scholarship that is awarded on an annual basis by PHIMA.
PHIMA is a valuable resource for prospective students, current students, new graduates, and seasoned professionals. As we demonstrated, PHIMA continually strives to meet the needs of all of these groups. I want to thank Laura and Lisa today for their help and their input. And for more information about joining PHIMA or about the association, visit us at www.phima.org.